Hello friends, few weeks ago I watched a video of a YouTuber Dhruv Rathi where he pointed out how an attempt to mainstream Jarwa tribe in 1970 ended up. It has a devastating effect on tribal people. It strips them of their self-sufficiency and sense of identity and leaves them struggling at the very margin of the society. Rates of disease, depression, addiction and suicide within the tribal community almost inevitably soar. This is really very good example of what primordial prevention is. People of Jarwa tribes were living life of hunters and gatherers, mostly survived on fruits, wild roots, tubers and honey, often have to travel long distances to collect it. We try to show them our modern world and our lifestyle. We offered them packaged foods, few were not able to digest it and many become obese because of it. They were introduced to tobacco and alcohol and they instantly became addicted to it. They are gradually losing their primitive way of life and culture, becoming prone to the risk factors and diseases of the modern world. Primordial prevention is a term used in public health and refers to prevention of emergence or development of risk factors in countries or population in which they have not yet appeared. Friends, in today's video, we are going to talk about the various levels of disease prevention. There are 4 types of disease prevention which can prevent or modify the disease occurrence in a population. First is primordial prevention, second is primary prevention, third is secondary prevention, and fourth one is tertiary level of prevention. Now let us talk about what do we mean by primordial level of prevention. This type of prevention focuses on reducing the risk of disease by addressing the root causes and modifiable risk factors, such as preserving traditional way of living, promoting healthy lifestyle, improving access to healthy food and water, reducing exposure to environmental toxins, and promoting policies that support health and well-being. The goal of primary prevention is to create healthy environments. By addressing the underlying causes of disease, primordial prevention can reduce the burden of disease, improve health outcomes, and promote healthy aging. To understand the level of prevention, we have to first understand the natural history of the disease, how the disease occurs, which are the causative factors or which are the risk factors responsible for the occurrence of the disease. It is divided into pre-pathogenesis and pathogenesis period, before man is involved and after man is involved respectively, and the primordial prevention start before pre-pathogenesis. That is why primordial prevention seems more intuitive and intangible, because there is no disease, no risk factor present. Now let's talk about primary prevention. It can be defined as action taken prior to the onset of disease, which removes the possibility that a disease will ever occur. How can we achieve primary prevention, or which are the measures we can design for the primary prevention? Let us take 2 examples, one from the infectious disease and another one from the chronic disease like coronary artery disease, hypertension, and try to understand what primary prevention is. In case of infectious disease like measles, we can prevent measles if we can prevent the interaction of measles virus, host and environment. How we can do that? By health promotion or specific protection. Examples of health promotions are health education, environmental modification, nutritional intervention, and lifestyle and behavior modification. Health education. Firstly, educating and encouraging people to take timely and necessary precautions to prevent measles. For example, avoiding crowded places and frequent hand washing. Health education is one of the most cost-effective interventions. Environmental modification. Provision of safe water, installation of sanitary latrines, control of insect and rodents, improvement of housing, etc. Nutritional intervention include food fortification, nutritional education, midday meal scheme, etc. Let us take example of diabetes mellitus and discuss what is lifestyle and behavior modification as a primary prevention. World Health Organization has recommended two approaches. One is population or mass strategy and another one is high risk strategy. In population strategy at mass level, we encourage people to adopt healthy lifestyle, which includes maintain a healthy weight, eat a healthy diet, a diet that is high in fiber, whole grains, fruits, vegetables, lean proteins, and healthy fats can help in preventing diabetes. Avoiding processed and sugary foods and drinks can also reduce the risk of diabetes. Exercise regularly. Regular physical activity can help in preventing diabetes by improving insulin sensitivity and glucose metabolism. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, or swimming. Manage stress. Chronic stress can contribute to the development of diabetes. Practice stress free activities such as mindfulness meditation, yoga, or deep breathing exercises. Quit smoking. Smoking increases the risk of developing diabetes. Quitting smoking can help in preventing diabetes as well as the other chronic conditions such as heart disease and lung cancer. Monitor blood sugar levels. If you have a family history of diabetes or other risk factors such as obesity or sedentary lifestyle, monitoring your blood sugar levels can help you catch any abnormalities at an early stage and take action to prevent the development of diabetes. While in high risk strategy, above measures are applied among people who are at risk of developing diabetes. For example, having family history of diabetes, sedentary lifestyle, obesity, etc. Friends, it is worthwhile to note that the many industrialized countries like UK, France, Japan, and many others were successful in eliminating number of communicable diseases like cholera, typhoid, and dysentery, and controlling several others like plague, leprosy, and tuberculosis, not by medical intervention, but mainly by raising their standard of living, which is a primary prevention. Another useful mode of intervention in primary prevention is specific protection. How we can protect host so that the disease agent cannot infect him? Well, it is possible through immunization by taking vaccine against various diseases, use of specific nutrients like iodized salt to prevent goiter, chemoprophylaxis, for example, chloroquine or doxycycline to prevent malaria, use of helmet to prevent severe brain injury, and so on. To summarize, primary prevention is a holistic approach. Activities and health measures such as sanitation, infection control, immunization, food, milk and water safety, environmental protection, and occupational health are all basic primary prevention measures. Most interesting thing about primary prevention is that they are available at low cost and are safe. Now let's talk about the secondary level of prevention. Secondary prevention is a level of preventive medicine that focuses on early diagnosis and treatment to prevent the progression of disease or complications. This level of prevention is often used for individuals who have already been diagnosed with a disease or condition or who are at high risk of developing a disease. The goal of secondary prevention is to identify the disease or condition early when it is still treatable and to prevent or delay its progression. For example, secondary prevention for cancer may involve regular screening tests such as mammograms or colonoscopies to detect cancer early when it is more treatable. Similarly, individuals who have been diagnosed with diabetes may receive regular blood sugar monitoring and education on self management to prevent or delay the onset of complications associated with the disease. The health programs initiated by the governments are usually at the level of secondary prevention. Few advantages of secondary prevention are early detection, preventing complications, reduced mortality and cost effective, and some disadvantages are it is ineffective in preventing transmission of the diseases, more expensive, and false positive can lead to unnecessary anxiety, further testing, and sometimes even unnecessary treatment. The set of interventions and actions aimed at managing and treating the consequences of a disease or a condition that has already progressed to an advanced stage or caused significant disability or impairment is called tertiary prevention. The goal of tertiary prevention is to prevent further progression of the disease, manage its symptoms, and improve the patient's quality of life. Examples of tertiary level of prevention interventions include rehabilitation and physical therapy. These interventions can help patients with physical impairments or disabilities regain function, improve mobility, and manage chronic pain. Medication management. Medications can help manage symptoms of disease, prevent complications, and slow down the progression of the disease. Surgery. Reconstructive surgery in leprosy or elephantiasis to improve mobility. Psychological support. Patients with chronic diseases or disabilities may experience emotional distress, anxiety, or depression. Psychological support can help patients cope with their illness and improve their quality of life. Support groups. Support groups can provide patients with sense of community and peer support, as well as valuable information and coping strategies. Examples of rehabilitation are establishing schools for the blind, provision of aids for the crippled, reconstructive surgery in leprosy, muscle re-education and graded exercises in neurological disorders, change of profession for more suitable one, and modification of life in general in the case of tuberculosis, cardiac patients, and others. The purpose of rehabilitation is to make productive people out of non-productive people. The advantages of tertiary level of prevention include improved quality of life. Tertiary prevention can help patients manage the symptoms of their disease, maintain independence, and improve their quality of life. Prevention of complications. Tertiary prevention can help prevent complications associated with advanced or untreated disease, such as infections, pressure ulcers, or cardiovascular events. Cost effectiveness. Treating and managing chronic diseases through tertiary prevention can be less costly than treating complications associated with the advanced or untreated disease. The disadvantages of tertiary level of prevention include limited effectiveness. Tertiary prevention may not be effective in treating or managing certain diseases or conditions, particularly those that are very advanced or untreatable. Side effects. Tertiary prevention interventions such as medications and surgery can have side effects which can be harmful to the patients. Cost. Tertiary prevention intervention can be expensive which may limit access for some patients. So this is all about various level of disease prevention. Thanks for watching. If you are first time here, don't forget to leave us like and subscribe the channel. See you in the next video really very soon.